take your questions. The Deputy Secretary General of the Municipal People's Government, Mr. Gu Honghui, from the Municipal Health Commission, Madam Wu Tianyu, and from the Commerce Bureau, Liu Min. First of all, let's give the floor to Mr. Gu for the updates. Good morning, dear media friends. As to the regional screening and the control measures in the city, I would love to brief you the newest situation. Right now, in Shanghai, the pandemic prevention and control is at a critical moment. With the national support and the other provinces' support, we have started the citywide screening, and according to the statistics, the newly added infected population is still standing at a high number. Since the start of the 5th April, the newly added positive cases amounted to 17,000. So that was quite an alarming number. And according to the screening and considering the experts' analysis, the municipal leadership decided that since April the 6th, we will hold another round of citywide nucleic acid test or antigen test. That is to say, for the already discovered positive cases from the last round of screening, they will be held together for another round of a test. And as to the details, from April the 1st to the 5th, the neighborhood with positive cases or any public places that once accommodate those people will be screened with nucleic acid test, particularly with the 10+1 sampling. And as to the delivery men and all the other people on mobility in the city, they will have to take a nucleic acid test, and there will be one single tube for one person for those people. Third, for the elderly people and the patients, they will receive doorstep services in sampling. And since April the 1st to the 5th, the neighborhood, the entities and public places without any positive case found will receive an antigen test. If positive, then they will take a nucleic acid test for confirmation with one tube for one person. And for the other people who are tested positive and are being transferred, they are not listed in this scope of test. And if the confirmation test is not out yet, the second round of antigen or nucleic acid test will be deferred right now. If their confirmed test proves to be positive, they will take another round of a nucleic acid test. Before that measure was in place, all the other entities must hold themselves accountable for the normal operation of the city, particularly the last 1 kilometer issue to deliver the necessities for the civilians. For the delivery men and the other city service providers, they must be managed in a closed loop. After this round of a citywide test being completed, based on the results of the test and the management scope of the neighborhood, we will make another determination about the next step, and we will make it public to you. So, dear civilians, please be understandable and coordinating with us. Thank you. Thank you, Mr. Gu Honghui, for your introduction. Next, Madam Wu Tianyu will brief us. Good morning, dear media friends. On April the 5th, the newly added 315 confirmed cases in Shanghai city, together with 16,767 newly added asymptomatic carriers, and 4 are found in the closed loop. 217 were found in the risky population. 40 are asymptomatic carriers before, and they were now the confirmed cases. And as to the asymptomatic carriers, 16,225 were found in the closed loop, and 510 were found in the risky population through our nucleic acid screening. Today, the 311 confirmed local cases, there are 162 male, 149 females. According to the administrative regional district, there are 23 in Xuhui, 23 in Minhang, 16 in Huangpu, 14 in Songjiang, and 12 in Jing'an, 11 in Yangpu, 11 in Jiading, 8 in Hongpu, 7 in Putuo, 7 in Baoshan, 6 in Qingpu, 2 in Fengxian, 2 in Chongming, 1 in Jingshan district. The above-mentioned 311 local confirmed cases have went through the epidemiological survey, the experts counseling, the lab test and imaging test, and 295 cases were confirmed to be the mild cases for COVID-19. 16 were confirmed normal cases. And as to the 16,767 newly added asymptomatic carriers, you could refer to the official website for their details. For the 16,767 asymptomatic carriers, they were confirmed by the CDC Shanghai branch, and they were diagnosed as asymptomatic carriers after the counseling. By April the 6th, the cumulative citywide close contacts amounted to 130,445. They were in our control, and about 110,000 population were confirmed positive through nucleic acid test, and about 110,000 people are the close contacts of the close contacts, and about 100,000 among them were proved negative. All the others are being tested right now. So, dear all, we are now running against the time in Shanghai. We are fighting against the virus. According to Mr. Gu just then, today, according to the citywide screening, we will hold another round of antigen test and nucleic acid test. Please coordinate with us according to that requirement to complete this round of screening. And I would love to warn you again that since Omicron has high transmissibility, so when you're taking the nucleic acid test, please be reminded that you should put on your facial masks and follow the guidance of the personnel, so that there will be no gathering of population, no talks between you, and there should be a 2 meters distance. After the sample taking, please put on your mask immediately and come back to your home to avoid any cross-infection. That's about nucleic acid test. As to antigen test, also, we use the nasal test, and there will be some instruments, for example, the card and the tube. They should be put in a sealed bag, and after being tested negative, throw them into the garbage bin. If you're tested positive, please report to your village committee or the neighborhood committee and wait indoors at home. And the sealed bag should be submitted to the medics so as to be treated as the medical waste. I know you're familiar with this procedure. Thank you for your coordination again. Thank you, Madam Wu Qianyu. Next, we open the floor to questions and answers. Please identify yourself before raising the questions. From number 14 line. Thank you. From Shanghai TV. I have a question to Madam Liu Ming from the Commerce Commission in the city. Now, it's very difficult to buy things, even on the e-commerce platforms. So how do you guarantee that those most needed products could be transported to the targeted population? Thank you for the question. Now, we are still going through the regional control and the nucleic acid testing. So buying food and eating are the key of our population's concerns. So the life necessity guarantee is challenging. For example, cross-provincial logistics is undermined, and the transportation to the terminal end is lacking. So we are receiving support to solve those difficult points. We hope to go through all the means to guarantee the basic needs of our population. First of all, we will smooth away the logistics. We will organize the source of the products, and with the support of our sister provinces, we have gone out to make the transportation channels smooth so that the necessities could reach out to Shanghai. Now, the NDRC and the Transportation Ministry have dispatched some vehicles to transport the necessities. The MOFCOM also requires certain provinces to guarantee the support of life necessities to Shanghai specifically. And in Shanghai alone, we have set up some transfer stations. We have opened some e-commerce platforms and supermarkets and shopping malls as the dedicated places to supply the life necessities. And we will try to guarantee that we have sustainable supply of life necessities. Secondly, as to the collective procurement, we have already broken the bottleneck of the terminal point, because now the biggest challenge is to how to deliver the products to every household. So we are working with different districts and neighborhoods and townships by coordinating with the supermarkets, shopping malls, and e-commerce platforms to improve our guarantee packages. We will increase the supply of the anti-pandemic products, the drugs, and we also rely on the third-party logistics companies to set up the collective procurement, collective distribution stations, the direct delivery system to the neighborhood. Meanwhile, as to the village level or township level, left alone elderly people and the other vulnerable groups, or the neighborhoods that have been in the risk control scope for very long, we will pivot towards those groups. We will try to distribute the life necessities and solve the last 100-meter problem. Thank you. Next question. From line 2. From the CMG. People are concerned about the accompanying of the infected children, and will there be any improvement to further meet those children's needs? Thank you for the question. You touch our soft spot. The infection of children is in the hearts of all of us. We are all parents, so we share the feeling. The treatment of the infected children must also conform to the pandemic prevention and control requirements and certain laws and regulations. But meanwhile, we must consider the fact that the children need special care. So we are improving our services and guarantee measures for the purpose of caring for children. And we will work on the following 3 fronts. For example, first of all, as to the accommodation of the children, we have dispatched our professionals so that the children could receive standardized and professional treatment. And also, we have set up a dedicated zone for the children for their accommodation, because children require more care, so we must step up our efforts in caring for them. And for the family with the other family members being infected, we will also adopt a special model in their treatment. For example, we will ask for their family members to take care of the children if they are all infected. And we must listen to any risky points concerning the children, and we ask the parents to sign the letter of consent before accompanying the children. But in the meantime, we must step up our prevention and control of the accompanying parents. For example, please follow the guide of the personnel and protect yourself well. For example, put on your mask scientifically and coming to meals in different time segments, and do not share the public products when you're taking care of the children to avoid any secondary harm or cross-infections. So we both aim at caring for the children. Let's work together for that goal. Thank you. Another question from number 18.
谢谢主持人。我有一个劳动报的记者，我有一个问题想问商务委的领导，就是网传快递外卖都要停了，是真的吗？那么对快递外卖审核是否有相关的
newspaper. I have a question to Madame Liu. I heard that a lot of the delivery services are stopped. So is that true? Thank you for the question. It is an utter rumor to suspend the delivery services. The delivery men are the key forces to guarantee our food and life necessity delivery. They play a very important role in meeting people's life needs. Right now, the delivery men are still on posts. The daily number of the on-post delivery men are about 11,000. So we guide the e-commerce platforms to hold themselves accountable in abiding by the prevention and control rules and have regular management of the delivery men, and they must check up their posts and enhance the delivery men's personal protection. On their posts, they must put on their masks and the gloves and helmets, and starting from today, for the delivery men and the other first-line workers, there will be one nucleic acid test and one antigen test for each person per day. They can only come to their post when those two tests are negative. Also, we have the co-prevention and control, both targeting the people and the objects. For different public places, we will have disinfection, and for the delivery station, there will be some APP and the other technologies to be used for checking the results, and the enterprises relevant must have some contingency plans. If they found anything abnormal, they must instantly do some disinfection of the public places so as to come to normal operation as early as possible. And in the future, to further enhance the operational capability of the e-commerce platforms, we organize the delivery men to have designated accommodation facilities and service stations. Thank you. This is the end of today's Q&A session. If you have further interview needs, please come to the municipal government and the health commission, and we will make any newest information public. This is the end of today's presser. Thank you.